This is Dr. Angie Nicholas, and she's from Pennsylvania. She started out as a family physician and never thought that she was going to create the life that she did. And, you know, in retrospect, she's the one who directed her life. She created her positions. She moved up, starting out of IT into CMIO and then Chief Medical Officer. How did she do it? How did she overcome obstacles, and how can she inspire you through her story? She also had a husband who passed away recently after being diagnosed 5.5 years ago of stage 3 cancer. Thank you, Angie, for being here.
Thank you. Thank you for having me.
How did you deal with, you know, you became CMIO and then you became CMO, and meanwhile your husband's sick, and you told me he went for a number of surgeries. I think you said like 5 surgeries and I don't know how many chemo sessions and radiation. How did you deal with that?
You know, I think when you're in the middle of it, you don't think about what you're going through. You look back on it and think, I don't know how I did that. But it was part of what we did. You know, John and I had a relationship where we were a team, and I never let him see the mental gymnastics I went through the night before he had a doctor's appointment of all the things I did to rearrange my schedule. But I got to tell you, you don't do those things without a really good team behind you and a really great leadership team ahead of you. And I work for a chief operating officer at Einstein Montgomery. Beth, if you're watching, welcome. But it was, you know, she and Anne-Marie and Pat were amazing support for me. And I knew that whatever I needed, I could ask for. Now, I will tell you, that's a hard thing for me. I don't like to ask for help, but I learned how to ask for help because there was no way I was going to be able to get through all of the things I did without their help.
Right. And, you know, something you said to me that really struck me and I was questioning you about, you said your mantra. You have 2 mantras that you kept saying over and over in our one conversation we had just before this call last week. And you said your mantra is you say yes to everything. You say yes to everything, and then afterwards, even if you don't know how to do it, you say, I'll figure it out. I'll figure it out. And yet there's some naysayers, and I was questioning you. There's so many people, so many leaders who say, you know, we're burnt out. We should start saying no. We should say, no, I'm not going to do that, and make your choices. How do you, can you explain that, what you mean by that and qualify it? Because I understood it better after you explained it.
Yeah. So, you know, I think you're right. I think all you hear about is, you know, just say no, you can't do everything. You have to limit, you know, you have to be effective. But every time I've been offered something, it's been something really interesting to me that, you know, would help me learn, would help me grow. And so it's a mutual, you know, expectation where I'm going to take on a new role, a new task, a new whatever. But then I get to learn something that I haven't learned before. And that's what helps me grow. The just say yes thing, I was in Costa Rica in December and met some friends, and we had this very philosophical conversation on Christmas Eve around what if you just said yes to everything? What if you allowed yourself to experience new things? And I think I did that without having that mantra. And there's a book by Chandra Rhimes, you know, about and I believe it's called The Year of Saying Yes or something like that. And but for me, it was around, you know, why would I say no to something where I get a chance to do something else? I get a chance to put another tool in my toolbox. Here, take case management. I don't know anything about case management. I know a lot about case management now. I know about denials and about, you know, about fighting for your inpatient days and about, you know, what the role of utilization review is. You know, I didn't know that 2.5 years ago. But if I would have said no, I never would have learned that. And now I can sit on a phone call with our insurers and have a discussion with them around, you know, how their denials are affecting our ability to take care of our patients. I think
it sounds like, Angie, you actually chose it because you actually were interested in it. It's not like you thought how do you prevent yourself from people taking advantage of you if you say yes all the time?
Well, if you say yes to new things that you get to learn, you have a negotiation then. Sure, yes, I want to do that. Well, but I'm going to need a little bit of help with why. You know, everything's a negotiation. And I think then you and I have team members that frankly want more opportunity. So
Right.
yeah, I can take this on and I could probably give that to someone who wants more opportunity.
Right.
And so by allowing myself to experience or have an opportunity to do something I've never done before, I can give my team an opportunity to do something they've never done before.
Right.
Everybody wins.
So it's a matter of asking for help. You just say,
sure,
yes, I will do that,
Mhm.
but
Right.
please help me.
And never but, and.
And
You know, the but,
thank you.
the but is the
That's
wall, right?
yes.
The end is the, you know, inclusion of now you're in this with me. You know, you've asked me to take something on. Now you're in this with me. And let's together figure out how we're going to do X, Y, and Z that we have sitting over here. That's the, you know, the other piece of the role or whatever. And the figure it out part is just, you know, sometimes you take something on and you think, oh my gosh, how am I going to do that? I tend to process. It takes me about 24 to 48 hours to kind of process things, which is frustrating for some people I think that I work with sometimes. But I do it best, honestly, on the treadmill or on my Peloton bike, where I'm just, you know, and then all of a sudden I'm like, oh, well, what if I did this? What if I broke it up into teams? What if and then all of a sudden I walk off that treadmill or that bike or whatever and have an idea of framework around what's next and what can we do next.
So Angie, what is your role right now? What is your title?
So I'm the Chief Medical Officer at Einstein Montgomery Medical Center.
Right. So these days with COVID going on, tell us about one of the biggest issues you're dealing with, because I know everybody's dealing with something.
Right.
And how are you as a leader, because it sounds like you're great at negotiating, you're great at getting people together, you're getting projects done. How are you doing that?
You know, I think this has been the most challenging, you know, experience in everybody's career because the leadership skills you had 3 months ago don't work now. You know, you really, the one thing that as I've been thinking about, you know, how have we been, I believe, very successful with our teams, with our hospital, with our caregivers. And I think it's around having trust, that they trust that we're doing the right thing for them, being transparent around what it is that we're doing. So as this started, we started a series of webinars, you know, whatever you want to do, you know, conversations with our team regularly so that they understood that, you know, the senior leadership team is meeting daily, twice a day, talking about visitors, talking about policies, talking about PPE. And so that's continued. That's continued through this whole time from the second week in March when we were the epicenter in Pennsylvania, actually, our little community. So we started that and we continue to do that. And I think it's allowed our hospital family to see, you know, we don't have all the answers. We're figuring it out with them and we're telling them as much as we know when we know it.
So when there was a problem with the PPE, what did you do about it? I mean, there's a lot of media out there with fights between two different groups, mainly the administrators and the healthcare workers. How did you deal with that?
So we have a chief nursing officer who is a great friend and a PPE expert at this point, and a team here at Einstein. And we met every day for a while around PPE. We communicated when we had to go to crisis mode and go to reuse strategies. We communicated, we tested it out. We asked them, what do you think if we sterilized the N95s? What do you think if we went to a 5-day reuse strategy? What do you think about that?
Who did you communicate to, Angie?
Well, to the entire hospital family, to our nursing staff, our physicians. You know, we asked them their opinion. We would go up and test our ideas, and then we'd come down and we'd make a decision with the Einstein Network team around how we were going to handle it at all of our campuses.
I think that's huge. You're being transparent with the people in the front lines.
And asking them their opinion, you know, and sometimes we couldn't do what they wanted, you know, and I get that. We love a new N95 every day for every patient every time. Obviously for aerosolizing generating procedures we do, but you know, we had to go to reuse strategies for some things. But our teams, understood that we weren't withholding PPE. In fact, we were doing our very best to make sure they had every single thing that they needed every day. We were
Wow.
in on the weekends. We were, you know, even if we weren't the administrator on call, we were coming in on the weekends to say, how's it going? What do you need? Is there something I can help with?
Right.
You know, one weekend as we went into our crisis strategies for gowns, you know, I'm talking to the nurses, you know, we need more hooks. We don't have enough hooks. Okay, I can do
I
that.
think that's a great learning point, Angie.
Mm-hmm.
What you did is different than what we saw in Seattle, right? You were there in the front lines, on the ground with them.
Mm-hmm.
I think the best leaders know exactly what's going on by asking and being there.
Right, right.
So
And
that's
and
awesome.
that's what we always do though. You know, it didn't feel different for us because
Got it.
that's how we manage as a team.
Right.
And so going in on a Saturday for a couple of hours, you know, made all the difference in the world because you know, honestly, I went down to Staples, I bought a bunch of hooks, and then I'm hanging hooks. You know,
Wow.
and one of the nurses said to me, well, you know, you don't need to do that. And I said, well, you're taking care of patients. Yeah, I do need to do that. I
That's
mean,
amazing.
it's my job to help them do their job. And
Love
that's,
that.
in my mind, that's what a good leader does.
I love that. And what about your hospital? Are you doing financially? A lot of the hospitals are in debt now.
Mhm.
And how are you dealing with that?
Well, I think we're all, you know, struggling with the unanticipated decrease in volume, the unanticipated decrease in surgeries, and the cost of the things that we had to put in place very quickly. So we are going to be in recovery mode. I'm pleased to say that we've been, again, partnerships with our nursing and physician leaders, and how do we bring back our elective cases? And we did that very thoughtfully. And I believe partnered with our surgeons to provide the best solution possible and do it safely to make sure that as we ramped up, again, we had the appropriate PPE, we have everything in place, we know exactly everybody knows exactly what they're supposed to be doing when they're supposed to be doing it. We
Right.
went through mock patients, you know, it seems silly, a mock patient for a surgery center that's been, you know, online for 6.5 years or 7 years, but, you know, times are different. It's time to do mock patients again.
Right.
So that was one piece of it. You know, the other piece of it is, yeah, we're going to have a big budget deficit. You know, we're going to have a loss greater than anticipated. And then how do you engage your teams in what are the opportunities that we have to see more patients, to generate more revenue? Because there comes a point in time where you can't, you know, cut staff anymore. You know, you go to bare bone staff, you can't see the number of patients you need to see. So it's a matter of being creative. And I have said to my, you know, I still manage the physician practice I was initially hired for, you know, let's be all of those crazy, wild ideas that you have at 3 a.m, let's do them. Let's do them right now, because we'll never have this opportunity again to be able to do something wild and crazy and see what happens.
That's awesome.
What if it actually worked?
Wow.
And there's going to be things that don't work, but
Right.
there will be a lot of things that do work. And so let's do them now. We have an opportunity right now. And that's what we're going to do.
Angie, how did you get that kind of mindset to just be brave and try new things and be like a creative originator and bring it to the forefront of the leadership team? How did is that something you learned, or is that just who you are?
I think some of it is who I am. I'm a little bit of, you know, throw spaghetti at the wall and see what happens. I like change.
Okay.
I do. And it's a little unnerving sometimes. I know that it's great to make a decision, but I'm also a make a decision and stick to it.
Okay.
You know, we said we're going to do X, we're going to do X. I know that we have this opportunity to do Y over here, but let's do X first and make sure X is going to work. But right now, you know, things are so up in the air that we make a decision today and then we get new information and we have to make a change. Hydroxychloroquine was it, and then it wasn't, and you have to stop using it. So you know, it's hard. And as a leader, you know, the leadership skills that I had, as I said, the leadership skills I had before are now different. And I've had to adapt my leadership style almost every day to a different team or a different situation or a different plan, because what I was doing 5 minutes ago isn't working.
Got it. So your leadership style, you mean it's different in that you're constantly shaping it. Is that what you're saying? As opposed to more structured leadership style?
Right.
What is what is your core leadership style, Angie?
I tend to be collaborative.
Okay.
I think that's what my preferred method is. But when you're making a decision about, for example, visitors, you know, we couldn't be collaborative about that. We had to decide right then and there, what are we going to do? You know, but we can be collaborative about putting triage in the call center. You know, again, you know, how do we do that? What does that look like? Who do we pick? How many do we need? You know, so you have to pick. Sometimes you have, you know, you have 6 or 7 different leadership styles, and you have to use your deck of cards and figure out for what situation, what's the right leadership style, and sometimes change in the middle, because what you thought was going to work isn't going to work now. You have to do something different. It's really, the leadership style now is adapt. I mean, that's the only thing I can think of.
Right. I mean, sometimes you can't just be collaborative. Sometimes
Right.
you have to be top down, and it's
Exactly.
in crisis.
Exactly.
Right? So
And lead, when you have the trust of your teams, you can do that, and they don't think, oh my gosh, they're trying to hide something. You know, they understand. Right. You know, I think in times of crisis, you know, we look to our leader to lead, and that's what they want. That's what our teams want us to do. And you can't just say, I don't know. And sometimes you do say, I don't know. I mean, I don't want to give anybody the impression that I, you know, have all the answers all the time. But sometimes it's, I don't know, let's think through this and let's figure out something, right. But we have to decide right now what we're going to do.
So Angie, thank you so much for that. That's so good, Angie. And how did the sickness and then the eventual passing of your husband? And I'm so sorry about that, but that was, I think you said last year, right?
Yeah. Yep. About a year ago.
Yeah. I can't even imagine how you did that, but how has that entire experience shaped you in your leadership and personally?
Well, you know, your life really turns upside down, and you really understand what it means to wait for a result, to wait for a test result, to sleep on the floor of an intensive care unit room because you don't want to leave your husband, to be up, you know, and when he was in the intensive care unit a lot in the last year of his life, a couple of times before that, in the last 6 months of his life, he was in 7 times, and so I learned how to be an advocate. I learned what it meant for our care, you know, for my patients that are caregivers that are up all night and then working all day and then up all night and then working all day. And in between the times he wasn't in the ICU, he was at home, and I was honestly kind of running a little ICU in my house. You know, you know, we talked a little bit earlier, you know, nothing scares me anymore. You know, I have watched, you know, I've watched him become very ill and literally, like, you know, rescue him off the edge of a cliff a couple of times. I learned what true friendship was like with friends who flew across the country. You know, I'm coming, and, you know, it was having that extra, you know, brain power for me, you know, to say, okay, I've got to fly him across the country on a ventilator. How do I do that? And learning what, you know, what caregiving from the other side is. You know, the nurses and the doctors in a strange city that I didn't know anybody, and said, you know, okay, let's think through this with you. Let's talk to you about what needs to happen. And, you know, it just really taught me how to, I guess fearless is the right word, because, you know, at this point, you know, I had to make really hard decisions really quickly about the life of my husband. You know, this is not life or death. You know, deciding what paper clips to order from Staples is not life or death. You know, we can get through this.
Yes.
And so, but I also know what it means to be life or death. And so those families whose loved ones are in the intensive care unit and can't go to see them pass, you know, my heart breaks for them, you know, and knowing what are the tools we have. We have really good palliative care. We have opportunities to do FaceTime and Zoom and some of these other things that we never would have done 6 months ago. I mean, people laughed at us thinking that we're going to FaceTime, you know, a member in the ICU, right? I mean, we thought that was stupid. Now it's like, here's my phone. Let's FaceTime them. So I think, you know, I think it really taught me, you know, how to be a better doctor, how to be a better hospital administrator, understanding, you know, these families. Like, I know what these families went through. I know what it means to watch your loved one die in my own intensive care unit. But I got to tell you, you know, that day, as horrific as it sounds, was an amazing day where they took care of me too. And for me to be able to tell a family member of one of our families, I understand, and they will take really good care of you, that means a lot, and that's what I always want. That's always the job I want to have, to be able to say they will take the very best care of you and mean that.
People who are on the fence about leadership, people who don't know, like don't want to take that step forward and be courageous, don't know, first of all, don't know what they don't know. What's your recommendation to, women leaders, because you're a great woman role model, but any person out of training or early in their career or even in the mid stage of the career to advance themselves forward? How do they do that if they don't think the way you do? Hard question, but
that is a hard question. That's really hard.
How do you start?
I have my coffee here.
Mentors. How did you do that?
Yeah, I guess I was lucky because it kind of evolved the way it evolved, but some of it is, is having that person. We all have that person that we work with, that we admire, that we trust, that we say, hey, I have a problem, and can you help me with this? And I think it's, I think it's just surrounding yourself with people that you can bounce things off of. And if you're thinking, I might want to, I'll go back to, what if you just said yes? What if you did it? What if you were successful? What would that look like? And what if you weren't successful? What would that look like? And I'll tell you, things don't always work out for me. Some things you make a choice and you're like, oh, shouldn't have done that. I won't do that one again. But that's how you learn, and allowing yourself to make mistakes, or make decisions that, maybe a change course, in the middle of it, allows the people that you work with to make mistakes too. But if you don't make mistakes, you don't know what doesn't work. And that helps shape what does work. So allowing yourself to think about what if I did this? What if I could do this? Well, so why couldn't you? Why do you have to say no? Why couldn't you say, yeah, you know what? Figure it out.
Right. And I think I like the Nike mantra, just do it. Mm-hmm. Just do it. Just try it and see. And what's the worst that's going to happen? That you're just back to where you were before.
Exactly. And, you get fired. Okay. Well, you get fired. So get another job,
Right. And the last thing is I want to ask you, because we talked about negotiation of what you're worth and titles. So first question is, how did you make sure as you rose up in your rank, and this could be a sensitive topic to a lot of people, they don't want to talk about salaries, but in general, how do you negotiate for what you're worth? And how do you even know what you're worth?
Well, I think knowing what you're worth are two different things. Knowing what you're worth in here is very different than knowing what you're worth on a piece of paper. And
right.
And Siri's telling me she doesn't understand. Well, Siri, let's tell you. So I think it's knowing what I'm worth in here is making sure that making sure that we have the inner sense of being treated with respect and trust and honesty, and you being treated that way and you treating everyone else that way, and being able to come home at night and think that you've done a really good job. And again, for me, it's what what I've done helped me or helped us take better care of patients. That for me is what I'm worth. The salary thing and the title thing is touchy, right? It's complicated. So making sure that you have the same title as the people in your organization. I was in a situation where I didn't, and it didn't really matter to me, but the optics of it to others mattered to them. And I thought, you know what? If it matters to them, it should matter to me. And then, again, I have a great leadership team, and my boss is great, and being able to have that conversation saying, honestly, for me, I really could care less. You can call me the dishwasher. You can call me chief whatever. You can call me whatever. It doesn't really matter to me. But for some people who are really very focused on the roles of the people that they work with, it did matter to them. And helping the organization understand my role then matters. And so, it was honestly, for me, it was a very simple conversation. For others, it isn't. And then, if it matters to you and if it matters to an organization and they don't see your worth, find some place that will.
You know, we need more diversity in leadership. We need, there's some noise in there. We definitely need diversity in leadership. And from my perspective, I'm glad to see a woman like you stepping up as chief medical officer. We need, you know, that's how we're going to be able to help the masses, by having people of different diverse backgrounds help the population, which is diverse.
Right, exactly.
And I agree. And also for your future, who knows what job you'll have in the future, and who knows what rank you'll have then, but it just is another stepping stone by having that title to go to the next level.
Right.
Awesome.
Right, exactly.
And then how did you ask for a pay raise?
You know, I guess I've been fortunate, and again, I think salaries are hard. They're hard things, and none of us are comfortable with it. I mean, I'll just be very honest. I'm not comfortable talking about salaries, but I also know that when I'm asked to do a job and I'm given a title, you have to have a salary commensurate with that. And so you have to know what it is. You have to know what your number is walking in and saying, this is what I expect. And it's not, you know, it's not obnoxious. It's just, you know, we have to be comfortable with that, because if you don't ask for what you want, you'll never get it.
That's right.
You'll never get it. You know, what's the worst they can do? They can say no. Okay.
Right.
So then
I always say that for me, the best thing to do is to understand what the other person wants. Right. And once you understand what that person wants, you tell them how you're going to deliver that to them, and why you're so valuable, and why you're worth that much. So it's really important. There's some skills to negotiations to learn how to get that. And really, like, you know, we already know studies show that women ask less and women make less. And, you know, part of it may be discrimination. We know that. But part of it is stepping forward and asking, knowing how to do that.
Right. And it's the yes and, right? It's, you know, yes, I'll take on this role, and I'm going to need more money, and I'm going to need a team, and it's never a no. It's always a yes and.
I love that. I'm going to remember that, Angie.
Yeah, you should. It really changes the conversation. You're never, you know, again, I don't want to say no. I want to learn new things. I want to be able to do it. And here's what I'm going to need to be able to do that.
Angie, it's been wonderful talking to you. I think we're coming down to almost an hour. So I could talk to you for another hour easily. I'm just so happy to have met you, and through the whole social media network. And gosh, I hope we can keep in touch. And I think everyone can learn from you, from the way you've mastered, you know, you call it luck. But then when we talk about what people like Oprah said, it's really just being prepared and having the opportunities, you know, and you're attracting them. So I kudos to you.
Thank you. It's been really a pleasure. It's fun to think about things that you don't really think about a lot. How did I do it? What did I do? You know, and this really, you know, again, it's all part of that, you know, self-discovery and the journey that I hate the word journey, more like an adventure, the adventure that we're all in here together.
Right. And how do people reach out, or can they, if they have any questions, or
absolutely.
I don't know if you even offer that. So
yeah. I love to network and meet people, and you know, you never know what's going to come from the conversation. You know, again, we, you know, met on social media. So I'm on Facebook. My profile right now is public, so we could publicize this. I'm also on Instagram as well. So feel free to reach out to me, and I'm happy to have further conversations.
Yeah, I know you've done a lot of speaking engagements, so some people might even want you to talk about your career path and how inspiring it is. It's something that people need to know. I think you should write a book.
Well, you know, we joke about the book that we're going to write at our hospital, because, you know, we say every day you can't make this stuff up, you know.
Yep. All right. Thank you so much. Happy Father's Day to everyone. And Angie, maybe we need to have another live in the future.
Sounds great.
Okay.
Happy Father's Day, everybody. Take care. Bye-bye.